My name is Arnulf Stenzl. I am head of the Department of Urology in Tübingen, Germany. At the same time, I'm part of the Executive Committee of the European Association of Urology. If you look at the scale of all the tumors, then there is a difference, of course, between male and female patients. There is 3 to 4 times more men that suffer from bladder cancer than women. And it is in men the 5th most common, in women 7th to 8th most common tumor. 1/4, we assume, to 1/3 is advanced disease, is disease that goes beyond the mucosa. It goes into the muscle. It goes even sometimes beyond the muscle. And at times, 10 to 15%, it is already metastatic when it is diagnosed. And out of these patients, few actually can be cured. Bladder cancer is, on the one hand, an expensive disease, because a large part of the patients, you could say fortunately, survive for a long time. However, there's a lot of interventions necessary to keep these patients alive, and in many cases to have them retain their bladder. On the other hand, they need a lot of instrumentation, they need adjuvant therapy, and if the disease progresses, then major surgery, chemotherapy, or immunotherapy is necessary. And all that is not pleasant for the patient, but in some cases it is dangerous and even deadly.